Good morning, everyone. Just turning off the minute. Finish. Okay. Now you can see this, right?
We did this yesterday.
It's personal hygiene.
Yeah, we did it yesterday, didn't we?
Personal hygiene we did yesterday?
Yeah. Chapter. Oh no, you put on it first and then you took it off, right? You went back. Okay.
We didn't do it yesterday because we did yesterday body mechanics. 16, chapter 16. It was just it came on to our screen. Okay, well, just give it. Okay, leave it now. Go. It's time to. Well, I'm expecting this about me. You too, Mujarala. Leave it and go now. Please. अगर आज आई ना कंप्लेंट इनको मैं रात समझ लिया ये बात अच्छी मेरी है So today we are going to do personal hygiene.
When we talk about personal hygiene, it's again safety for us, for our clients, everyday important for it's important for us, for our clients, for our families. This is a daily routine that we need to follow, and not only personal hygiene means cleaning, but it also means the way we present ourselves, what kind of clothes we wear, in what kind of season. Everything should be appropriate. If we are looking at our personal hygiene, it also depends. We also are looking at the point when we look at the thing, it says grooming, brushing, all those things also include personal hygiene. Personal hygiene, it promotes comfort, safety, and health. If you are clean, you're healthy. If you're clean, if everything is not in place, your clothes are not tight, you're safe. If your clothes are tight, if you wear jewelry that can be tight, it can strangle your neck, it can cause edema in the fingers. So it also can be a risk for safety. Sometimes people end up in hospitals because they were wearing jewelries and it got struck, it needs to be cut off. Then that piece of jewelry being a part of your personal hygiene uh, becomes a safety issue. It includes activities to clean the skin, mouth, genital areas, and anus. Intact skin and mucous membranes are the body's first line of defense against diseases. Yes, that is true. If your skin is not clean, hold on, my it says if our skin is not, as I mentioned earlier also to you guys, you make sure when you're washing your hands, you make sure when you don't overwash your hands, apply some cream as well, because that's very mandatory. If your skin is not intact, if your skin has breakdowns, you are at a risk of more infections. Why? Mucus, it prevents microbes from entering the body and causing an infection. If you know, the infection cycle starts from uh, what we touch, and it can be mouth, it can be skin, it can be anus, and again, the end of that chain cycle is either mouth, either hand, or anus. Saying you guys ate food. We touch it, we eat it, and then we will throw it out with poop. When we ate it, we started from our hand, touching it with our dirty hands or with our clean hands, going in the mouth and pooping it out. It can also be like when we eat this food, we throw up. The way it can be the same port of entry and same port of exit. It's called port of entry that we ate through mouth. It can be same port of exit, we throw it through mouth. Sometimes there are times when and the port of entry and the port of exit is same. Also, not only that, but we are always the host. If there's mosquito bite, we will be the ones carrying malaria. If there's food poisoning, we will be the ones carrying this food poisoning. How? We will, it's up to us where we poop. If people in, or let's say in rural or urban areas, any area, think if they poop on the riverside, what would happen? These bacteria, they affect the whole water. Or on the water, near the water body, there is a water tank, which is from a washroom, sanitary tank. It can affect that water that comes. And if people are getting sick, that is epidemiology, how they see. How come this area people get sick all the time? How many people drank from this water body? Water. What's wrong with this water? Maybe there's some sanitary tank nearby, underneath, near to it. So those are some of these things, hygiene things we have to look into. So talking about pooping and all, it has to be, if you poop, make sure you wash from front to back. You never wash from back to the front. If you are cleaning your clients, you don't clean your clients from back to the front. You always do from front to back. Then personal hygiene. Most people have hygiene routines and habits. Routine care is given during the day and evening. Yes, we do brush face, wash our face, and brush our teeth every morning, every evening. AM care, evening care, before breakfast, morning care, and after breakfast. Yes, AM care means that is provided after breakfast. Early morning care is the care that you provide before breakfast. If you are in wherever work setting place, if you give care to your clients and it is done before breakfast, would be before 9 o'clock, 8:30 or 8:30. 8:30 would be the best time. Before 8:30, it means early care. And if it's after breakfast, 9 o'clock, 9:30, it's called AM care. We mostly start at 7:30. The care that 7:30 care is called early care, early morning care. Afternoon care after lunch, before early evening meals, before evening meals around at 1700. HS care or PM care or evening care before sleep. HS care before it's around 2000, 2000 to 2200, 8 p.m. to 9 p.m. That's called HS care. You assist with hygiene whenever it is needed. Your client may feel frustrated, angry, or embarrassed because of needing help with personal care. Always promote tips. Again, when you're providing care, they might not like it. They might get angry, frustrated because we are helping them. It's not just because we are helping them, because they feel like they can't do anymore. They are troubling us. They are no more having any values of life. They're useless. Oral hygiene is mouth care. Does the following: it keeps the mouth and teeth clean. Yes. It promotes mouth odors, infection cavities, that is dental cavities, dental caries. It increases comfort, makes food taste better. It prevents periodontal diseases, gum diseases, inflammation, okay, pyorrhea, inflammation of tissues around the teeth. If you see older people, they always complain about ulcers in their mouth. It's always good to give them, at least if you're not brushing them, you always have those green swabs, get them and clean their mouth with this. If a person is end of life care, again, if person is dying, we don't brush them, but we do get cold water. And then in the other glass we might get some mouthwash. We get swabs, those green swabs, mouth swabs, and we clean their mouth or wet. The purpose is to wet their mouth so that the skin does not break, because if they are dying, they're losing water, they are dehydrating. We don't give them any IVs, that we are allowing them to die. So the skin is prone to breakdown, and this area is very mouth oral inside cavity is very sensitive. So what we do is we wet it quite often, every hour, or even more than that if needed. Oral care is given on awakening, after each meal, and at bedtime. We always give oral care when the patient is awake. If your patient is in a sleepy mode, is not doing, is not opening her eyes, he is not doing very well, like eyes closed but still following directions, drowsy, you don't give oral care. And again, when you're performing oral care, do not put your fingers or hand inside the mouth. Make sure you always use swabs, brushes, tongue depressors, all those things, not your finger. Dry mouth is common as a result of oxygen administration. Again, when you put people on oxygen, I told you they get dry. If you are, if your client, if your patient or a resident is on oxygen more than 3 to 4 liters, always try to use a humidifier, small water tank under the oxygen. Otherwise, they tend to get very dry. If ever it's not available or it's not recommended from the doctor, sometimes then just get some swabs and try to wet their mouth. Otherwise, it will start to peel off. Another common result is smoking. If people smoke, it will become very dry. The oral cavity becomes dry. Oral cavity is at a risk of, again, ulcers, sore ulcers. Decreased fluid intake from dehydration. People who are dehydrated, they always will have dry mouth. Mouth breathing. People who do not breathe through their nose, always breathe through their mouth. It's just like they are losing moisture. And that's why if ever people are COPD and they can breathe, they do like that, they always will have dry mouth. Their tongue, you will see, will have like those small pimples kind of a thing. It's not pimple, it's really dry tongue, just because they use more of their mouth than their nasal cavity. Anxiety. Why? Anxiety, they will have dry mouth. People who are anxious, they breathe faster. During anxiety, they huff and puff. With huff and puff, they lose more water, they lose moisture, they use their mouth oral cavity, and it becomes dry. And some of the medications also have a side effect of getting dry mouth. Most of the medications of diabetes and other diseases have a side effect that they cause dry mouth. The mouth contains many microbes. Always wear gloves and follow standard practices when providing mouth care to the clients. Yes, I told you this can be a portal. This is a portal of entry, and this is a portal of exit. This mouth contains a lot of bacteria, a lot of microbes. That's why always use a glove. Do not put your hand, not only for the risk of microbes, but also of a risk of losing any of your digits if things go here and there. If your patient gets angry, frustrated, or anything happens. So always use the gloves when you're looking at somebody's mouth, and try using sponges, try using tongue depressors. Now, equipment. Oral hygiene. How do we provide oral hygiene? We use toothbrushes, everybody knows, toothpaste, dental floss, and mouthwash. These are freely available in every care home, long-term facility, and in hospitals. For clients with dentures, you will need a denture cleaner, a denture cup, which is blue or green, a denture toothbrush or a brush. So what you do, if your client has dentures, you remove them in the nighttime, HS time. Why? You put them under the water, allow it to get washed. Once the water will flow, all the impurity, and then you try to brush it. Get the container, put some cold water in it, no hot water, put some cold water, fresh cold water. If they have those denture tablets, okay. If not, just cold water and the denture. Observations for your oral hygiene. After giving oral hygiene, report and record. If you are brushing somebody's teeth and you see there was some blood coming out from from the mouth, teeth, tongue, anywhere you saw, you would report, because some people, they are on blood thinners, and if you brush their teeth and you see it is bleeding, it means they might be losing more blood through that. It's better to know that it is a time when their blood thinners may be getting accumulated in their body, or it might be that they will be at a risk of high bleeding. So always make sure, if you are brushing and you see any bleeding in the mouth, you inform. Another thing is, you might see the tongue is cracked. You might see some ulcers on the tongue. You might see some blisters. So please make sure, if you're providing oral care, go gentle, watch for things. You might see the color of the teeth or the gum area, gum line has changed. It's no more pink, it's cyanosed, it's red, or it's white, because there's a pus in the gum cavity or in the tooth cavity, in the gum jawline. So bleeding, dry, crackled, swollen, or blistered lip. Yes. Bleeding, redness, or swelling of the gums, as I mentioned. Irritation, sores, canker sores, or white patches in the mouth or the tongue. Sometimes it can be they have thrush. You will see white kind of in their between their lips or inside their cheek buccal cavity. So please make sure that you report. It can be thrush as well. Missing or loose tooth. Sometimes while you're brushing today, you saw, oh, there's nothing, there's a space. What is this from? Could be, and they are old, they had tooth there while they were eating, it just came out, they swallowed it or they throwed it, and you don't, if we don't know what happened. There are scenarios where we had clients with tooth on one of the sides, and some had these front tooth. They were eating some food, they didn't realize that they swallowed it. Some might throw. So just be careful of, if you see now there's an empty spot in their mouth, before it wasn't, that means it is empty tooth. Maybe they hit something, they broke it, they don't realize it fell down. So it's your job to look at all those things. Rough, sharp, or clipped areas on dentures. Yes, when you're providing care, when you're cleaning the dentures and you're brushing with your eye, you might see that, oh, the denture line is very rough. It looks sharp. You can always, wearing double gloves or touch it. If you feel like it's very sharp, you can always report it. We can get it fixed. Family will go and get it fixed, or we can ask the family if they can book an appointment. Somebody from the facility can go and help. Complaints of pain or discomfort. If there is a toothache, if there is pain in the gum, if there's any blockage in the lymph drainage, it might cause pain. It might be discomfortable. Sometimes you're talking, you want to sneeze, or they sneeze, something unusual they open their mouth and close them, they might have that joint pain. Now, the TM joint here, somehow it locked. So that could be. It also can occur because of degeneration, because of their aging. Their joints, when they overuse the muscle during eating or talking or sneezing, it might cause pain to them. Because the whole face is having specific joints, if overusing, it can cause trouble. Difficulty swallowing or speaking, yeah, that is more common than anything. They do have difficulties in swallowing and speaking. When they're swallowing, they cannot swallow their medications, they cannot swallow their food that has been given. Reason being, the amount of saliva that is produced in their mouth is decreasing after every day-to-day because of aging. And things can be easily swallowed if you have moisture in your mouth. When you eat, you chew, the moisture in your mouth allows this chewed food to become like a ball and get swallowed. Your tongue would push it. But if there's no, there's no grease, things cannot move. And this greasiness in our mouth is produced by the saliva that we have. Just because these are older adults and they lose this amount of, they just are very dry, they are dehydrated, they don't have the same amount of saliva production, it might cause issues with swallowing. Foul smell, it can, halitosis can be due to poor oral care. Also, foul halitosis could be a reason of constipated. If your client is constipated, they might have halitosis. If your client has poor oral care, is not brushing, does not brush, does not clean her or his tongue, is not being wiped off properly, has food in pocketed areas, will definitely smell. Presence of food or foreign objects. Yes, again, if they have those, some people have piercing everywhere, they pierce their tongue, they pierce their lips, that could also be one of the cases. And it's very common, piercing the tongue and the lips. Brushing the teeth. Many clients perform oral hygiene themselves. So if your clients are even semi-independent, but they just know who they are, they would definitely do their brushing themselves. Some clients need help gathering and setting up equipment. Yes, the people who would, most of them who would brush their teeth themselves might need help with you getting them a basin, getting them a brush, paste, and things set it up, the table set up for the AM care, and then they will perform their care. Encourage the client to be as independent as possible. All the time we talk about it. Make sure if they can do it, allow them to do, encourage them to do it. You may have to brush the teeth of the client who are very weak, again, cannot use or move their arms, true, are too confused to brush their teeth. Some who are very, very confused, who don't know what's going around. You might need help. Or sometimes you're weak, and if you have clients, everything is perfect, but they have Parkinson's, they might be shaking, something like that. You might be doing it for that. Brushing teeth, you might be brushing a child teeth. Children, if you're taking care of people, kids, if you're working in peds, or you are being just like a nanny caregiver, that time you might be brushing the, and children should be not like, they should be brushed by the caregiver if they are under 3 years old. If they are about 3 years old, we assist. We hold their hand, we allow them and give them that sense of independence. Children should start brushing teeth at the age of 3 years. Children 3 to 6 years old should be given a toothpaste containing fluoride, size no bigger than a pea, with each brushing. Or other older children can do a thorough job, but may need to be reminded to brush. Yes, older kids, you might have to reinforce brushing every time. Flossing, which is not very common, everybody wants to do. But this is very important part of oral care. For our clients, for us, we should always floss. Flossing removes plaque and tartar from the teeth, removes food from between the teeth, is preventive. Do at least once per day. It's very important. Do not use toothpicks. Do not use other because that might create spaces between your teeth that might injure your gums, and on top of it can also become a safety reason. But if you floss, it's always the best method of oral care. Should be always done after you brush, every time. Mouth care for an unconscious client. Now, how does it look like when your client is unconscious and you want to perform oral care? Unconscious clients may have mouth dryness and crusting on tongue and mucous membranes. I told you they have that crusted in the tongue. It looks like they have those huge white, they're not, we can't say pimples. It's like goosebumps inside the tongue, and there because that's the crusting that's from dryness. The care plan tells you what cleaning agent to use. Can you use any mouthwash? Always we can use mouthwash unless the client is allergic to mouthwash. Otherwise, we always, and there are some oral gels so you can use, but you can also take a look in the care plan to see if it's recommended or not. Use sponge swabs to apply the cleaning agent. Whatever you're applying, please make sure you use sponge. You don't use your finger. And when you're doing, because he or she is unconscious, you might need to hold it. Do not hold with your fingers. Do not hold with your hands. Always use tongue depressors again. Applying a lubricant to the lips after cleaning prevents crackling of lips. In every setting, wherever you work, they have those white lip gloss kind of lubricants. You can always apply them after you're providing. Check the care plan. Follow agency policies and your scope of practice to be sure you can provide the type of care. I don't think so. Providing oral care, yes, unless when we talk about oral care, why it's saying check policy. Some clients, when they eat, they do have a problem of pocketing food or swallowing issues. Some food is left in their buccal cavities, so they are not able to swallow down everything. If they are the ones who are not very conscious, who have problems, you might have to suction. I mentioned the scope of LPNs is to do mild suctioning. They cannot, and RNs can do deep suctioning here. Other than that, this suctioning RT needs to do. So everyone has, you don't have a scope of suctioning. LPNs have a little bit. RNs have, they can go up to the throat, and beyond the throat is the RT. But if ever you have been given training from your workplace setting, you might be able to do that mild. Take it from here, take it from here, unless you're not being given. If you're given, that's wonderful. If not being given a teaching, you can do it. That part of oral care, then you won't be able to. Mouth care for an unconscious. Protect unconscious clients from choking and aspiration. I always tell you, if your clients are unconscious, they are not going to do a good job in swallowing things. Most of the times, it is even though you sit them up, they are at a risk of aspiration pneumonia and they aspirate. Breathing fluid, food, vomitus are an object of the lungs. If they throw up, while they throw up, some vomitus goes into their airways. When they are drinking, while they drink, because they're so unconscious, they swallow, but you don't swallow properly. You're lying in an not uncomfortable, but not in a proper position of swallowing, or you're not using your right muscles, which when we need to press, like voluntarily, involuntary, when we try to swallow, we are not using our muscles properly, and it might go into your airways. Position the client on one side with the head turned well onto the side. Use only a small amount of fluid to clean the mouth. Do not insert dentures. Keep the client's mouth open with a plugged tongue depressor. Always assume that unconscious client can hear. Yes, let's talk about this later. Mouth care is given at least every 2 hours. Follow the nurse's direction and care. For this unconscious client, always remember, we put the client in a side position, leaving the mouth, because if ever when you're cleaning, you have to put them on a sideline like this, so that whatever you're putting in their mouth, it will come out on from the side of the mouth. It does not stay, and it does not cause it's this is a CPR position. Even in CPR, you also put them on the side so that everything that you put in the mouth would come from the side. That is what we are looking. Then you don't put dentures, you always use tongue depressors, holding so that everything that you put in mouth during mouth care has come out. Your clients, you will have to do the oral care. We don't do every 2 hours, even less than 2 hours. We do this care plan. Talk about something. Unconscious hearing. The first sense that goes would be you're eating, watching, looking, but the sense that goes last when a person is dying, he no more opens eyes, no more can feel, no more can is warm, nothing. All senses have been lost. The last sense that a client loses before he or she dies is hearing. Till the last moment of their breath, they will have a sense of hearing, unless he's deaf. No matter what it is, how hard of hearing you are, whatever the scenario is, leaving behind deafness, the last sense that any person can lose, any human being loses, is hearing. So when we say, "Oh my God, it's so bad," they can't hear, they can see you, their eyes are not open, they're cold, they're dying, but they can hear. So please be mindful of that. This is the sideline. You always put the client in the sideline. You put that kidney basin, use a tongue depressor, hold their tongue, brush their teeth, and out. Denture care. Dentures are set of artificial teeth. Complete or partial dentures could be both or one, upper or lower, and make sure that you know which one is the, if you have a client is using upper and partial dentures, Is he using complete dentures? If it's a partial, is it the lower one or the upper one? Mouth care is given and dentures are cleaned as often as natural teeth. Yes, 2 to 3 times a day. Dentures are slippery when wet. That's true. To use a cleaning agent, follow the manufacturer's instructions. Simple as that. Yes, this is true. You can. But what we do normally, get the dentures, put it under the running water. Everything would come out. Get the brush, clean it with the toothbrush, put it in cold water. If you don't have the cleaning agents needed, because you can't use any cleaning agent, you need to use whatever has been ordered. So this is simple where you can get in trouble. Never. Hot water causes dentures to lose their shape. So I told you, do not use hot water. We never use hot water cleaning, no matter how sticky, no matter how oily or whatever is on the dentures. We never use hot water because it will change the shape. It's just a cold wax. If you put a little bit of hot water, it starts to change the shape of that. Remind clients and residents not to wrap dentures in tissues and napkins because it gets stick on it and it's very hard to remove it from the denture. You clean dentures for those who cannot do them for themselves. Follow agency policies regarding cleaning dentures. Bathing. Very, very important. Who do we bathe? How do we bathe? And when do we bathe? We bathe everywhere. Depends on who it is. We take some into the shower. We do bathe some inside the bed. How can we do sponge bath? People who are dying also get washed. They also get a bath. We do a sponge bath like that. Bathing has the following benefits. It cleans the skin. It removes microbes, dead skin, perspiration, excess oil. Cleans the mucous membranes of the genital and anal areas. Bath is refreshing and relaxing, we all know. Circulation is stimulated and body parts are exercised. Everybody knows. Observations are made. You have to talk. You have time to talk to the person. When we bathe someone, we do get a chance to look on their body. We might be able, if they're lying in the bed and we are changing them quickly in the bed, we might not be able to look at a lot of things. But when we give them a bath, when we give them a sponge bath, we might be able to look at lots and lots of things. Saying if they have ulcers under the armpits, if there's any pimple under their armpits, there's any like armpits, groin, back, heels, not all the time when you come in, you pay too much attention. Oh, somebody put the socks on. It was so tight. I removed it while giving a bath and I saw it just rip off the skin. Because when you're cleaning, you would see a lot of, oh, she has some kind of allergy. Yesterday she didn't have it, but when I wanted to give a shower, when I wanted to bathe her, she just has that kind of allergy. So bathing, showering, it depends on how, whom, and where we are doing. If we have giving a sponge bath or we are cleaning someone, bathing someone, giving them a shower, we have to look at optimum temperature of the water. It shouldn't be cold, it shouldn't be hot. If it's too cold, again, they might get sick. It's not good for anybody. If it's too hot, again, it might burn the skin. So optimum temperature of water is very, very important. Let's say we are giving a sponge bath. Make sure those wipes, they are warm wipes. Do not wipe them with cold wipes. They might get chilly, they might get sick, they might not like it, they might not want to get any care from you anymore. Just because you wash them and clean them with cold sponges, cold wipes. So we always wipe them. We do have those long those incubators. You put them there, they get. If not, you can always warm your wipes inside the microwave that you have for client care, not for personal co-worker care. The partial bath, tub bath, or showers may be given. Yes, either we do complete partial baths, tub bath, or showers. Depends on, again, if ever somebody this complete or partial means, do you need to get your hair washed today? Would be partial. When somebody is using a tub bath, is she going till the neck, or she's going to get washed with her hair as well? Showers, if you're putting the person on under shower and you're giving a shower but does not need hair washing, you will have to put a shower cap. You'll have to make sure that you cover the hair with the shower cap before you give them a shower. The bathing method depends on the client's condition. If your client is able to go in a tub, if your client is able to stand under the shower or sit on a chair under the shower, or might get washed inside the bed or on a wheelchair. The bathing method depends on client's condition, self-care abilities, and personal choice, what they also want at times. The client's choice of bath time is respected whenever possible. Yes, bathing frequency is a personal choice or employer's policy. Saying this, if not always their choice, but it is, you're working in a residential one, you don't give them showers every day. You always have one day or 2 days, depends on what has been fixed by the employer at the time when they were admitted. And the time now when you're providing care, it might be they might refuse, or they might once in a while they might ask for more shower. You can always say, hey, today it's not Thursday, it's not your shower day. Oh, I don't want it on Thursday, can I get it now? Well, let's see if we can switch someone for Thursday, if possible. Otherwise, if it's becoming a routine, if it's becoming a habit for that client, we don't acknowledge those things. Whether physical activity and illness may also affect bathing frequency. If you are if your clients need to get shower, if it's summertime, yes, they might get frequent showers, but if it's winter time, it really, or a fall time, it really changes. Physical activity, if they're able to move, if they're able, if they're doing a lot of exercises, they are getting that physio done, they might need showers frequently. If somebody is sick, is throwing up all the time, you might need to give them showers a lot of time. It's not the shower under the water or in the tub. We are talking about sponge bath is also considered to be a shower. So it depends on how and which one they are getting. Observations for bathing client. You report and record the following. What? The color of the skin, lips, nail beds, the sclera. When you're giving the client a shower, you will be looking at on their skin all over the body. If they have any bruising, if there is any discoloration anywhere, if they are not only bruising and discoloration, but it could be when you look at it, oh, I don't know what, it looks different on her. It's kind of scaly, it's red, it's hot. Oh, there can be inflammation going on. It's swollen. So that thing, when you look about, when you talk about it. It's nail bed. I saw her nails. It's all white. It's blue. It's eye-nosed. Pink, good refill. Keep looking at eyes. His eyes are yellow, jaundiced. So those are the things that you look. You might report location and description of rashes. As I mentioned, when you give them a shower, when you're cleaning them up, bathing them up, giving them sponge bath or any other type of bath, you might look at, oh, she has rashes on her back, on her arms, upper arms, or between the thighs, wherever. Mostly these are the places where they get rashes because they are always leaning on their sides. They might get it on their arms or on the thighs. Sometimes they're very, very heavy, they're incontinent, they get rashes in the inner side of the thighs and in the groin area. If they are very, very bulky, under the breast and under the skin folds of their stomach. So what do? You cleaned it. Is there something you can do? Yes. Very important. You don't need an order for it. You don't need anything for it. Just your brain box. You go, you clean them, you dry them up, you get an EPC cream, the one that is used for skin breakdown. You apply that. If ever that can cause some clients, they get allergies from that. You get an intra-dry are that it's a special kind of cloth that we use. You might be familiar with dry fit shirts, Adidas, Nike, dry fit. Those dry fit shirts are made of intra-dry material. So you can be in the workplace have not in the form of a shirt, but it's in a roll. You cut it according to the size needed, and you might put it small piece under the breast. It always soaks the wetness, leaves the skin dry, and reduces the risk of rashes and redness. You might put it on the groin, you might put it in between the folds of the thigh, just because they're very, very incontinent. She pees and she gets rashes. Even if she's peeing, it prevents those rashes. So that is what you might be looking at. Bruises or open skin areas, I mentioned dry skin, I mentioned pale or reddened areas. Redness caused by inflammation, redness caused by skin breakdown, scratch, anything. Drainage or bleeding from any wound or body opening. If you see there is, oh, there's blood coming out from it, or she has removed her IV, she needs to have her IV all the time just because she gets IV med. Today it is red or it's not red, it's just she pulled it out a little bit. So there is that blood coming from there, there's some fluid coming out of there. That's what you report. Swelling of the feet and legs, which is very, very common. Your clients, they get swollen feet, they get swollen legs because they are sitting in a chair or in a bed for a long time. Stasis again occurs. They have issues retaining water. They might, oh, today the edema is very much. I might request the doctor if she or he passes by today in the facility. Mostly in the facility, you cannot otherwise get it done every day. So what we will be doing, I'll ask her to increase the dose for the water pill so that water gets rid out of it. You might be telling them, oh, she's now getting more heavy, she's having a lot of edema. I look at it, it's swollen ankles, it's swollen feet, it's swollen legs. Some people, they also have cellulitis. Oh my God. Not cellulitis, gross, plus cellulitis. Half of the skin is gone. It's gooey. That gooey thing is dripping off. It's like an elephantiasis. The leg is like one leg is like an elephant leg. It's called elephantiasis. Swollen, warm to touch, painful. So if you are giving that kind of a client a wash, you might need to give them pain meds. You have to remind them every time you move. I'm so sorry. I know. Is it so painful? I'm gonna move your right leg. I'm going to move your left leg. Some have both on both legs or both arms, depending how bad it is and where it is. Corns or some people do have corns and callus on their feet. This is quite common because they have those corns. It's very hard for them to step on the ground. It's very painful. So we might have to every like week, depends, or every 2 days, or might not be applying corn caps. Depends on what it looks like. Skin temperature. Oh, when we gave her a wash, she's so cold. She's so hot because that needs to be reported. If it's too cold, there's no good circulation going on, you might need to report. You will get a not only report, go get a warm blanket, give them a warm blanket. If they're using a gown, the facility gown or residential long-term care gown, they're very poor. They don't have their own clothes. Get one, put it on. Get the other one, put it the other way from the back so that their back is covered and it gives them warm. Get a warm blanket, put it from the back, and then put the other on top of it. Get cold blanket or like the one that's not in the this is what is it called, a hot um, fridge where we put those blankets. Get a regular one, put on top of it so that the warmness of that hot blanket is not lost. Complete bed bath involves washing the client's entire body in the bed. Bed bath is usually needed by clients who are unconscious, who are paralyzed, who have cast, who have fractions, and who are weak from any illness or such. This may be a new experience for many clients. It may cause embarrassment, feeling of loss of privacy. Yes, if you are being given a wash by someone, you might not like it. You might not, just because of shyness, because of privacy, and because you also are losing that sense of independence, loss of independence, you might not like it. Towel baths and bag baths. For a towel bath, an oversized towel is used. It's very less times first we give a towel bath. First we grab those hot sponges or those wipes, then we get a towel. If ever the person is too big, those small towels will not work. You might get a large one then. It covers the client's, and whenever you are cleaning and you need to remove the whole gown, always make sure you get a blanket, you cover the rest of the body with a blanket and clean slowly. That part, the rest of the parts of the body should be covered with a blanket. Imagine your client Nick and somebody from a family member, a friend gets in. So please be mindful when you're cleaning your client. You have ripped their clothes off because they were dirty, they were soaked. She needs grab a sheet, put it on the rest of the body so that you're preventing privacy. You're giving them privacy. You're not doing something wrong. You have to promote those things. Bath towel is saturated with cleaning solution with water and soap free. We do rinse free, sorry, not soap free. We always have in your workplace, you will see, you will have rinse free soap. That means The soap that you are applying to them does not need water to be removed. Otherwise, normally when we apply any gel for cleaning, we have to put some water, we have to wipe it. But this one, no. They're called rinse-free shampoos, rinse-free cleansers. Bag baths are commercially prepared or prepared in the agency. Some people, they might need, let's say, partial bath. I don't want to wash my body today. I only want to wash my hair. If they are getting this, bag baths are like, they have a shower cap. You just put it on their head, massage it slowly, leave it for a time, and then you remove that. Again, a shower cap could be a rinse-free shower cap, or the other one to wash the hair under the head. Depends on how independent your client is. Is he or she able to get her head under the water? If not, you will get the rinse-free shower cap, put it on the head, massage it, leave it for 5-10 minutes, and then open. Done. You will see those things in your workplaces. We do often use those. 8 to 10 washcloths are moisturized with cleaning agent that does not require rinsing. I mentioned it to you. There are some times when we use those non-rinse, non-wash. You just put that shampoo on, get the wipes. You might need a little more. Wipe it. Depends on how big the client, how small the client is. Before use, they are warmed in a microwave. We do have there's a warmer. We always put them in the warmers. The blankets are always in the warmers. And then we also have warmers for these wipes. They have that green orange light blinking on it, saying green, it's good to be used. Orange, do not use them. They're still not warm. You might pick up. And every time you remove one wipe, replace the warmer with another bag. Otherwise, if you keep on removing, by the time you need it for the client again, you might not have anything. That's why it's our moral duty. If I took out two, if I took out one, I replace them with one or two. Partial bath involves bathing the face, hands, axilla, underarms, back, buttocks, and perineal areas. Always wash your client from front to back, no matter who it is. So, some clients bathe themselves in bed or at the sink. If they are, oh, this is your wipe yourself. They start to wipe themselves between the fingers, face, ear, neck, body. They start doing that. You assist as needed. If ever, because they cannot reach to their back, you will assist them on the back. They cannot reach at the back of their legs, you will assist them. Even though they're doing rest, I don't think so. Nobody at that age can wash their back. It's very hard for us. We also need aids to wash our back. So how can an older person do that? So you will assist them washing their backs. Tub bath or showers, tub baths and showers, falls, burns, chilling from water, or risks. Safety is important. Protect the client's privacy. Tub bath should be no longer than 20 minutes. Follow the nurse's direction and the care plan. Once you clean some people, oh, I just got in here. I'm not, no. 20 minutes is the maximum amount of time, including hair wash. Safety with the tub, bath, or shower. Be alert. The client may become faint, weak, or very tired during the bath. I always recommend you guys to do whenever you are giving a shower to someone. Do not make him or her stand. Always get a stool table or a chair, shower chair. Make them sit. Allow it. If they're feeling weak, if they're feeling sick, if they can stand for a long time, they can always hop on it. The tub is cleaned before and after use. This is very important. One person's germs should not go to another person to prevent the spread of microbes and infection. Good breathing. That's just hold on, my dear. 1 minute. Have someone coming into the three students are joining from today. Gurleen Kaur, Sahib Pratap Singh, Seni, and Gurpreet Singh. We don't have anybody here. Okay. Okay. So, safety with what we were saying, safety with the tub bath or shower. When we are doing this, we use hydraulic lifts, we apply safety devices. When we put that client on a lift, please make sure again the lift is locked, the feet of the lift is locked. Otherwise, when he wants to move or you're giving shower, they move, they can fall over along with the lift. So always when the person is on a lift, make sure the lifts, they are locked in. The docking thing is on. Lock the wheels of the shower chair. Test the water temperature. This is very important. Very, very important. In client's home, safety devices such as grab bars, I've told you, transfer boards or shower chairs may be helpful. This is always not helpful, very, very important. It's not only in the client's house, it is also in facilities, long-term care homes. We do have grab bars, we do have transfer boards, but they're general, they're not for one person. Normally, they're generalized. We have generalized kind of, but if it's a client, if it's someone, you will have their own personal ones. Dealing with bathing challenges, clients have the right to refuse a bath. You need the client to be informed, have an info. Oh, Mr. Smith, you know what? Today is Tuesday. It's 11 o'clock. It's your shower time. I don't want. Then you would say, why? I don't want it in the morning. Do you want to get it in the evening? We can help. We will move you to the evening. We can always adjust timings if possible. If not, then we just try to reinforce. If not, still not working, then we might simply say refused and notify them. Reasons for refusal: client feels too ill or weak. Client is afraid of falling or getting chill. Oh, I feel cold. I'm gonna put warm blanket. I'll use warm blankets. I'll use warm water. I'll use warm wipes. We'll just get you some blankets afterwards. I'll get you some hot tea or a hot chocolate, hot water once you are done. Depends what the facility allows. Client is embarrassed. Clients cannot tolerate the bathing position. If they don't tolerate, you might sit them on a chair. You might get them that put them on a lift. Even inside there in the tub, you might have to use a hydraulic machine or that lift inside. Inform your supervisor of the client's refusal. Do not beat the client against their wish. You cannot wash. Just so you might not uh, allow this thing to do. Always make sure when you're giving a bath, some clients have their own personal products that need to be used. You can't use anybody's products on anybody. If this person is getting a shower, get her things. We have a small basket. We move their things. Oh, this is her shower gel. This is her shampoo. This is her cream to be applied after she gets a shower, after she gets a wash. So making sure that these things are there. If this person got a shower, it's already done. uh, Put it back, get your other client. Because it can be a shower day, you might only have to give a couple of showers and your day is done. So making sure, however, how it works, make sure that you put their supplies back. You use the proper supplies, what is being needed. If ever they are getting a shower, after shower, put the cream, not the regular cream, the medicated cream. Please make sure you apply them. You look at if they have a wound. uh, Let the nurse know that the dressing, if it's wet, it is not being covered, it came off. All those things you will have to notify. You will be the ones to be notifying all those things. Dealing with challenges when you're giving a bath. Clients with dementia may be frightened by bathing. Use a calm, pleasant voice. Do not rush. Do not rush. Divert the client's attention. Try the bath again later. What we do, we try to be very gentle. We reinforce. Hey, Mr. Smith. Um, Today we're just watch. We're not gonna do this. We're gonna do it by the. If you want, try doing it yourself. So make them feel comfortable. Make them feel uh, better. Try getting these things done quite often. Did you like it? Did you like the experience of having a bath? Once they are done, do not keep them when you're drying them up. You just dry their hair and body, then you keep them on the chair or without clothes. First, you want to dry the floor. No, ask help if things like that needs to be done, so that your client is not wet, he's not naked. Make sure clothes are there, already prepared, everything is prepared for you. Otherwise, they might get chilly, they might not want to get the shower again. Clients that urinate or defecate. Yes, some people, again, some of your clients, they are incontinent, they have no control on their bowels, they have no control on peeing. They might pee in the tub, they might poo in the tub. Now the water is dirty. So we do have a lot of challenges at times when these things occur. We have to think how things need to be done. If we have an incontinent client and it had happened with this client once, we make sure that we don't use a tub. We better use a shower for him, where the water does not remain and he has to dip himself. Remove the stool. Again, Control your verbal and non-verbal reactions. If somebody would poo in the water that you keep and you're washing them, you might lose temper. You have to be very mindful. We don't lose our temper. We try to be slow, steady. Hardened secretions of stool on the client's body. Sometimes your clients are having poop, which is so hard, it's very hard to remove. Get their body brush, but do not scratch them or let it soak and then wash. Those are some of the challenges that we do also see. Erection, privacy is important, provide safety, give the client some time alone if they need, if possible. If your client, she has ejection, like she wants, he or she, mostly he, they have problems just because somebody touch, give them a time, you go out. It's inappropriate to be there or inappropriate for you to touch that time. Massage the back. Back massages, back rubs are very, very important as well because they're getting a shower. You might, or you are applying medications to their back. It is important. Relax the muscles, stimulate the circulation. They're given after bath or after evening care. Can be given when you reposition. If you're repositioning someone, you can always give them a back massage. You can always apply that back cream. And it might last for 3 to 5 minutes. This massage, back massaging, or this applying of back rub, Voltaren, or anything that diclofenac, Voltaren diclofenac cream, those rubs, they are only the rub that you do is only for 3 to 5 minutes, not more than that, because we don't need to rub it. You might apply lactocalamine just because their skin gets red there, they have some rash, it is good for their skin. So you only rub for the maximum time is from 3 to 5 minutes, not more than that. Observe the skin before the massage. When you are massaging the skin, you have to make sure to look at the skin properly before you massage how it looked. Was it red before when you massage it? Was it cold when you massage it before? Was it sinus blue, or were there any bruises before? So this is very, very important. And when you apply, because we are also looking at the just hold on, my dear. Hello? Yes, my dear. Who's this? We have a new student here. Mr. Sahib, can we put the camera on and can you introduce yourself, please? Yes. Let's see. One moment. Good morning, my dear. Can we get a quick introduction from you, please? We can resume this topic back again for a while, but let's get to know who you are, where you are from, what your expectations are. Let's.
Hi, it's my first class today.
Yes, my dear. Welcome aboard. And are you familiar with this healthcare? Have you been in healthcare before, or where are you from? Huh?
It's my first time.
First try.
It's my yeah.
Are you a resident here in Canada, or you
Okay.
just, huh?
I'm a resident here in Canada.
Okay. So you are aware of some rules and regulations before. That's fine. The purpose of asking you is that are you aware of the rules and regulations? That's good.
Yeah, I know.
Wonderful. So today is your first class, right? Let's see
Yeah.
how we will try to accommodate. We do have quite a number of students who join late, and there are some more who are joining with you. Um, so what we would be doing is we'll the things that you have missed, we would be covering it later for you guys. But now, if at this point, um, maybe you might not understand what we are talking about or what we are going through, let us know. The rule for our online classes, uh, cameras being on. If you have questions, put your mics on. If no, then we'll put it on a mute. At any time, feel free to ask a question. Don't hesitate, okay? The thing that I want to know from you is, do you have any idea of what this thing means? Being a support worker, what it is and what you need to do, or what and how you work with it.
Yeah, like I have studied a quite bit about this course, and I am also a medical student from a schooling from India. I'm in medical stream, so I'm quite familiar with this thing.
Okay, that's perfect. So that this is not new for you. Taking care, providing care,
Yeah,
getting into this is not new for you, right?
yeah,
Okay, no problems. Let's finish this one chapter, and at the end of the chapter, we'll just give you a quick rundown of how things happen, what you need to know again as our moral duty. So even though you know it, we'll just go for a quick rundown. Okay. So when it comes to back massaging, as we were talking about, we need to observe the skin before the massage. We need to put lotion, reduce friction because they have dry skin, their clothes, it will rip, it might cause more skin breakdown. We always, because this is cold, the cream can be cold. Always rub it between your hands once it's been rubbed. If ever it's possible to use a warmer, but not all the time. That's not true. So what we do, put the cream between our hands, try to rub it and apply it on the back. We can do only massage once during the shower. We cannot do massage anywhere other than the back, or we just apply cream on their body. Inappropriate touches, please be very mindful when you are providing care, who you are, again, gender differences, and touching inappropriate areas which can be inappropriate. So you have to also be very mindful of that thing. After the massage, you apply some lotion to the knees, elbows, and heel. Just because those are bony prominences, they are at a risk for too much skin breakdown. Perineal care. Perineal care or pericare, it involves cleaning the genitals and anal areas. Cleaning prevents infections, odors, and promotes comfort, removes stigma. Perineal care is done daily during the bath. Whenever the area is soiled with urine or feces, clients do their own perineal care if possible. We have to give perineal care to everybody, whether being incontinent or continent. If those people who are continent and are independent, you might only be the ones to provide them with the supplies. If your client is incontinent and is still independent, again, you will be providing it. But if your client is incontinent and is dependent on you, you'll be the one providing care. Some people, some clients, not people, some clients, they do have colostomies. So they don't, the pieces would go in the back. If ever they are cognitive, then promote independence, because you would be telling them, yeah, this, hey, whatever the name is, this is the container, would you mind to unfill it? You promote it. I don't like, I will get you an order gone. We apply order gone in the air so that the smell does not affect them. You need to make them touch the bag, help them, promote them, slowly create. They might not show interest in it, but we have to, because we'll not be the ones doing it all the time. However, if they are weak and they're in the facility, they are weak in, they're shaky, they can't reach to it, or they have any illness, they have any backache, then we'll be the ones. But if they are quite independent, then please promote. Ask them to do it. Ask them to empty the colostomy themselves, and you hold it for them. So promote independence. Now, if you have a client who has a catheter bag, does that mean we don't provide care? No, we still provide pedicare. We still clean them up. We not only clean the perineal area, also clean the Foley. In olden days, we had to change night bag to even morning bag. But nowadays, those things are not there. You make sure when is the time when the bag needs to be changed. Is there a due date? We applied this urinary or this Foley has been applied on, let's say, October of this or December of this. It's good for 3 months. When is the due date for next Foley? So we always clean, because if they had a bowel movement, it will go on to the Foley as well. Clean the Foley, make sure the Foley is secured to their leg again. If you are emptying the Foley, look at the color of the urine in the Foley bag. Are there any clots in there? What is the color? Does it look clear? Is there any sediments? Are there any? You have to keep an eye on all those things, and you need to report them. How much was the output? Is it more than what it used to be? Was it very less? If it's scanty, has he not been drinking? Or because we need to know if if there's no output, is he retaining? So keep an eye on it. Normally when we do it, it's more than 500, but today it was just 200. So today the output was not much. Let the nurse know it was just 200. Keep an eye on it. If it keeps on going, they might need to talk to the doctor. Check the weight of the patient client every day. Depends, he or she might be retaining. Procedure embarrasses many clients and nursing staff. Yes, when you're giving pedicare, it is not an embarrassment only for the clients, but sometimes we ourselves are not very happy to give that kind of, we also feel embarrassed. Following standards practices, medical asepsis, always wear gloves. Make sure you are wearing gloves all the time. If you are cleaning, have the soaker pad with you, extra soaker pad, extra pad, clean wipes. All those things should be with you all the time. Put the garbage bin next to the bed, just in case. Do not drop anything. Do not keep it on the ground so that the ground also gets dirty. You just simply chuck them in the garbage bin. Whenever giving pedicare, use warm water, not hot. Again, it can burn the skin, it can cause rashes. Work from the cleanest, that is from the urethra, to the dirtiest, that is to the anal. Always from front to the back. Please make sure when you're wiping from the front area to the back. Use washcloth, towelettes, cotton balls, swabs, according to whatever your agency, policy agency, your workplace setting says. Clean down each side, then at the center, first on the sides and then on the center, starting again from the front to the back. Rinse thoroughly, pat dry and rinse. If ever it's not clean, you can get some those sponges, or you can get the wipes, make them extra wet, and then squish them. The water would go on them, wipe them, dry them up, apply cream as needed, and pedicare reporting and recording. When providing pedicare, perineal care, report the following observation. If you see any redness, if you see any swelling, if you see any discharge or irritation, you would see if there's any blood coming in, where the blood is coming from. If they have external hemorrhoids, you can see. If you can see the anus is swollen, that means it can be internal hemorrhoids, which are very, very visible. Odors, it's the urine smells fruity. It can be they have DKA, diabetic ketoacidosis. The sugar level in their body can be too much. It's going for a rise. It can be, it stinks, they might have urinary infection. So odor also plays a very important role. You need to watch for that. Complaints of pain, burning, or other discomfort while they're urinating. Signs of urinary or fecal incontinence. A male client, foreskin not retracting. That's true. Report and record the care given, whatever kind of care you gave, whatever you saw. If you normally we do how much is the bowel, was it a medium, was it a small, was it a large, what was it, type 1 2 3 4 7, it's up to 7. Was it liquidy, was it that bowel chart, it says chunky, was it soft like a sausage, all those things are on the chart, and according to that bowel chart you report, was it up in commode, was it in the washroom, was it incontinent, mixed. So all those things you will notify. Menstrual care. Menstruation is the monthly bleeding of a client with female genita. When blood flows from the urethra through the vaginal opening, sanitary pads should be changed often, every 3 to 5 hours, to promote good hygiene and comfort and prevent odors and infection. Wear gloves when you are providing menstrual care. Dispose the sanitary pads according to the employer's policy. These pads, they go in biohazard. Menstrual care, reporting and recording. When providing menstrual care, report and record the following. Is the smell? Is there any fever? Is there any redness? Any swelling? Any irritation in the perineum? If the client, he complains of pain, burning, difficulty urinating, or other discomforts, if there's heavy bleeding or scanty bleeding, for example, the sanitary pads become soaked more within an hour, so they will use a number of pads. It's not about, but it can be he or she's losing blood. If she's anemic, it can lead to a lot of problems. So if there's heavy bleeding, you need to know it can be internal bleeding as well. Large number of blood clots. If you see big clots in there, you will also have to report them. This is what we have for our personal hygiene for today. Any questions? Nima, are you there? Mhm. Okay, Amrit, we'll go for a quick break, and I will be coming back at 11 o'clock, okay? Let's see. Okay, let's get back here. And see. Let me quickly take a peek through this further. As personal hygiene, that is. Mhm. So our next one that we would be discussing for today would be starting our careers, starting your career. Why would you like to start your career? What we need to do and how things need to be done. Yeah. Quickly getting organized. You may need to have access to a computer. Very true. A printer, a telephone, cell phone with voicemail, office supplies and resources. It's very, very basic. Setting priorities and goals, determining what type of support work do you want to pursue. Would you prefer to work in a facility or in a community setting? Do you want to be self-employed? Do you want to work full-time or part-time? That's very, very important. And when it comes to preparing your resume and your professional portfolio, a resume is concise, 1 to 2 page summary of your experience, your education, your work-related skills and personal qualities. Your elements in your resume should be your experience, your education, your objective, your profile, and your interests, which is very, very important. In your portfolio, you also add any new updated learnings. When it comes to any updated learning, if you have gone on Learning Hub, have you ever done any Learning Hub activities?
What kind of learning activities, sir?
If you go, do you have access to Learning Hub?
Learning?
Learning Hub?
No.
No. Remind me when we go to the school. I think I will ask Zishan. It's a very good opportunity. You get it. I think the school should be able to provide you that link. You have it, and there are courses that are free. Some courses, when you do, your employer pays you for them because you spend time 4 hours, 2 hours. It's written on this minimum 2 hours. You can take days, but you will be only paid for 2 hours. But some of them,
Like I was about to ask you about that food safety and first aid course.
yes,
Yeah.
food safety and those safety courses, CPR courses that are to be taken separately. They are, you have to go, I think you pay 80 $80 and something for it. Wait, I will double check with how the new policies are. Could be your employer can provide you with that amount. If not, then it's better to do it. It gets expired every year, food safe, though it is good for 2 years, but
Okay.
initially It gets expired every 1 year. And once you do it, you don't have to go and do it over and over again. You just have to review it online. You pay the fee, there's some fee. But when you would start working, it would be covered from your employer. Initially, it's not covered, but because you are also planning, I know you're planning to work in different settings. I don't know what setting you picked up though, till now. I'm not pretty sure that you are yourself aware of going in one setting.
Yeah, I'm not sure about it, which one I would like to be.
Yes, I
So
know. I could
I
see,
might be
I
comfortable.
could sense it from the way you speak. Oh, how does this work and that? It could be or not, but you need to create a portfolio.
Okay.
In a portfolio,
Initially, I would be starting with a part-time thing.
yes, but create a portfolio, make a resume. If you work on your resume, you bring it down to school, we can help you more. You know
Okay.
what? Create a resume. What we do is, how do you make it different from people? You will go on, I will open up this for you, Learning Hub. On Learning Hub, go generally on when you go safety, you will learn how safety things, how to uh, dispose things, those are free courses. It's good to know them. It might take a while. You're not in a rush to finish them in 1 hour, 2 days, or 10 days. But at least when you have done something before, and then it gives you a certificate stating you completed it with 95%, 100%. If the quiz you may fail, you can do it over and over again till you get 100% in it. It doesn't matter, and you can present that 100% one in your portfolio. Oh, when you apply, you already done with your food safe. Oh, you're done with your safety courses. Violence prevention. If they ask you, why do you know anything about violence, how it would, yes, I know. Oh, I know everybody knows what you do, but what's special about you? I have already done the course on the Learning Hub. It makes
Yep.
your portfolio look better. It gives you opportunities, more opportunities for jobs. If I forget next week, till next week, I forget the Learning Hub, do remind me. We will go on Learning Hub. I look for the courses that can help you bring up your resume. I will list those things so that it would be quite different from people, and keep your immunization. That COVID vaccine you got, if you have that, are you vaccinated? Don't have to ask. Yes, there's a copy of my um, vaccination proof back
Yeah,
in.
I'm
Right?
vaccinated for 4 times.
That's what I'm saying. So what you do, are you to make it like, see your presentation. I'm your, oh, are you vaccinated? Yes, I'm vaccinated. Proof is in my resume. Oh,
Okay.
yeah. Well. They feel like he's even prepared for the job before. They don't dig in. If you don't have it, then they will tell you, can you give me that? Can you give me this? Can you give me this? Can you give me this? So, but once you have prepared something from before, oh, yeah, that's perfect. Go ahead, don't worry. So it's perfect. They give you a job. That's why prepare a resume, make a file where you keep those things in. Whatever you have an experience, do not hesitate. If you have ever done forklifting, put a certificate of that. Oh, she's able to do that. You have your driving license. Because driving license is an issue with it's a personal information we don't want to share. Don't put the number, but in your resume, do put driving license. Driving you can do. License number can be given on preference. Like if you ask me the driving license number, then, but we don't. You should write in your resume that you're able to drive. But reason that will help them to know that you can move clients from one area to another area. Again, opportunities being build up. If you do anything, any course related to wound care, Oh, you did wound care? Yes, I just did wound care just to know how wounds look. If I ever have a client, or resident, I would be, I can justify what it looks like, and I can tell what it is while I'm providing care. So if you know something, if you know what this vegetable is, how to cut it, then you know how to cook it, then only you can cook it. If you never knew what the vegetable is, we all know vegetables need to be washed and cut, right? But how do you cook it? Every vegetable has its own way of cooking. Same thing, every wound we know we need to clean. But is there something we need to know? Is this wound, what are the precautions that I should take with this wound? What this wound is this wound a first stage wound? Second, is this a burn? What it looks to me, I should be able to know. So looking at that one, if you are interested, we can show up. Those are free courses. Go for them, get your things done, put them, stick them in your resume. It would enhance your resume. Getting started on your resume, make a list of experiences, whatever experience you have, put them in, whatever education from current to back, skills, qualities, make a list of skills and qualities an employer would want to see in you as a support worker. As a support worker, I should be humble, I should be voluntary. If you have done any voluntary anywhere, put that thing in, compare the list, identify your areas of expertise. Oh, I can do multitasking. I've been doing multitasking with some, let's say, this company, this facility, whatever, you can put that thing in. When are you available? Don't ever say I only mornings. You can say, if ever you're the only truth is if you're going to school, then say I'm at school, I can only do evening. If ever not, I am flexible. Because when you say I'm flexible, honestly, you only need part-time work or you want full-time. When you're flexible, would you mind working on weekends? If you're okay to work on weekends? Yes. Some people, they only say, I need to work on weekends only. Okay. Then you're not a good candidate because we don't have only weekends. I only want to do nights because there's mostly nothing for nights, or mostly days. I want to sleep at my night. So be flexible. Compare the list, identify your areas of expertise, store a copy of your resume on a flash drive, on your memory stick. Wherever you go, you can right away get in. Also, you can keep it in an email. Nowadays, we carry our email everywhere. We don't have to even carry our flash drive with us. Types of resume. We have one that we call as chronological, where we highlight employment history from most current employment, how and where I've been working. You use the best format to use those who have a steady history of employment, and if there's any favorite gaps, it's okay. 2023 I was doing this, 2022 I've been doing this, 2021, unless there's a big gap, then otherwise go chronologically from year to year, from current year to the back. And if ever you have any, you work with any organization, if you have any volunteering, try to add on it, try to put all those things through. Functional, you highlight your skills, your functions, briefly give describe about your position, the place where you have been working. I've been working as a supervisor, or I've been working as with clients. I've been doing security. Whatever you have been doing, try to put it in a functional format, looking how it would attract your employer to get you a support worker's job. Best format to use for those who have little work expertise, long periods of not working, or frequent job changes. It's better to put it in if you have worked a lot of jobs and people want to know why you are switching your jobs. It means, are you not trustworthy? Are you not reliable? No, it's not about reliability. It's just about, I wanted to see different changes and things. The workplace, I want to work in an area which is not abusive. Whatever comes to you, whatever feels like this is going to be a functional format for me, because what you put in your resume would be the only thing that they would look at, or they might ask you about questions. If we don't get enough time to describe ourselves, would you mind dropping off a resume, and you don't get a second chance. So simple is that, make your resume the way it should look like, and it attracts your employer to have you. My current education, I'm done with this one. I'm at my best looking for this. Can you go for a criminal check? Yes. Are you vaccinated? Are you up with your health record? Yes. Are you able to get your flu shots done every year? Yes. Even if you don't want to get it, that's a different scenario. But for now, you don't have any of these things, but try to put them. We will also be performing an assignment. Once I correct that assignment, once you get that assignment done, put that thing in. It would reflect in your reflection that you have started doing, PowerPoint, you know how to use computers, and you have created assignments where you have already started working with your clients. When you will go for your practicum, put that thing in your resume that you went for a practical to this place. All those things you will add in it to make it look better. Your resume, ask yourself, does your resume highlight any qualification that outline some job posting on Indeed, or you would see in lots and lots of places need a support worker. So see what in your resume would match with this job that you are looking at. What is it? I want to apply for a support worker, or a private caregiver, or a client at home. You can always make your resume according to that. You can always change things here and there. If you have taken care, if you have kids and you have been able to look after the kids, you can always say, worked as a nanny. That's it. It depends. If you have elderlies and elderly, dementiated, aggressive, you have worked with someone, someone you have looked after, you can always say worked with, experience working with ABB, experience working with this. Just try to put where simply private caregiving. If it's someone in your neighborhood, if it's someone who you know from family, you don't have to disclose the names. Just simply say from private caregiving. Is the information relevant that you're providing? Yes. Have I expressed clearly myself? Is my resume consistent? Have I accounted for all my time? Is my resume correct? The format they use, some people, they have formats, they have picture on it. We don't use those kind of resumes. So you have to make sure that whatever you're doing should be correct and updated. Formatting and printing your resume. Choose a simple professional looking format. Check your computer for present resume designs. Do not use more than one font. Always use one font on the same thing. Keep graphics to a minimum. Do not crowd too much onto one page if you're printing. Use good quality of paper. Staple pages together so that they're not lost here and there, and they can go chronologically according. Otherwise, they might read one page. Oh, what's this? They just get confused. They don't have too much time reading and looking at it and putting them in places. So if you have more than 2 pages, 3 pages, resumes keep on going, and you have to build up these resume. It's not just that you would not put the previous one. Whatever new is coming up, you keep on adding. So it will be at a point, it will be more than 5 pages, 6 pages. So you would staple them all together and keep going. Professional portfolio. A portfolio is a binder that I was talking about. You need to create a professional portfolio for yourself where there is a binder which contains applicants' resume. You will get a binder. You will have dividers in it. The first part of your portfolio should include a resume, a cover letter. Second, references. Third, whatever certificates you have. If you have to go on Learning Hub, get those certificates. And if you have done a food safe, that one. If you have done a CPR testing, you would do that. When you do the math fit test, you put that math fit test in it. Your COVID vaccine, you would put those things. If you have any letter of recommendation, you have worked with someone and they give you a letter of recommendation, put those things. Awards, if you ever had got any award, proof of volunteering, workshops done, you go for a workshop, police check, yes, criminal check record, you will put there, and other pertinent information. All those, if you would be doing an assignment with us, put this assignment in there. These all serve a purpose. Its purpose is to easily relieve information about the client, about the applicant in the interview. This is going to help you when you are giving an interview. It helps people get interviewed nicely. It helps people to know you very well, and it gives you a broad area of getting selected. Copies of your for your portfolio. You can have a hard copy binder which you can present at the day of interview. You place each item in a plastic page protector. As I mentioned, everything goes, each one of the paper goes in the plastic page protector, and then you divide it. You make a content table. You label the page of the dividers. You will create a content table of content, resume on this, go on this one. So this is what this portfolio you will always be creating for yourself, and it would increase. Sometimes we also want to create a portfolio. We can't carry it everywhere. We will create an electronic portfolio. All items should be scanned there, placed. Everything you would scan according to what you would put in your hard copy, and then you will place them. You will make it. You can also create a zip folder for it, and once you download it, send it to someone. There's a download it. Page 1, 2, 3 will come like a book for you. Then always make sure that you also have an electronic file or a link that can be sent to the employer, which is very, very easy, which is very convenient for you and for your employer. You don't have to. Also, make sure whatever information you put in there is correct, is not stolen, is not from somewhere else. Just because if you are being asked for a proof of anything from there and you are not able to provide, it is again a criminal thing. So finding and following leads. The main source for advertising positions are online job sites, the community newspapers, which include electronic versions, and college career services. Yes, check journals, employment advertisement, search engines on internet, posting board at the college or at potential employers. If you go on Indeed, you will be getting lots and lots of information. If you happen to visit Pulse, it's called Pulse. If you go on Pulse, you'll be able to apply for Fraser Health. There are so many job opportunities every day coming up in different hospitals, in different acute, subacute hospice, long-term care facilities that are under Fraser Health. Vancouver Coastal Health, you will have to go under Vancouver Coastal Health job search, and then it will come up for you. Find an unadvertised position. You would also check with your college career services. You will contact people you know, check with your area home care program, look at the yellow pages, look at your local library, attend job fairs, and check your Canadian Employment Center. To the most important thing is when you go for your practicum, you have a good chance to know them. You will know a lot of people. You will know a new facility. If you do very well there, you might get hired right away during your practicum. If ever then you want to switch, you can switch. But for that time, it would be a good experience to get into there. Selecting your references. A reference is a person who can speak to a potential employer about your skills, about your abilities, about your personal qualities. When you talk about references, it can be anyone you have been working under. It can be your instructor. It can be your school. It can be someone who from outside you have been in touch with. Avoid using family member or friends. We really don't use family members and friends because that's not acceptable. We just don't want to know from a family member or a friend. They might not be very truthful. But if you have someone you worked with, who you worked under, if you have your instructor, oh, how do you know? Because during the reference, they ask you, how do you know this person? How long have you been knowing this person? What do you think why would you recommend this person for this job? You can't say because he's a family, he takes good care of us, he's my brother, he's my sister. No. So please remember, yeah, she worked under me, he worked under me. I've been a, let's say, instructor. He was a good student, he was punctual, things that need to be addressed. That why am I hiring you? To me, you look punctual. You have been punctual. You're cooperative. You can always add those things. We can rely on you. Reliability. So make sure when you're selecting your references, sure that you select references properly, and also some of the qualities you always reflect in your resume very nicely so that you would be the best candidate for that job. Sometimes you use your previous employers. You have a very good relationship with them. It's not that we left the job just because you get fired. No, because you need to work. Oh, why did you quit the previous job? I didn't want to work in acute care in hospital now. I wanted to see how the long-term care facility looks like. Or I was working in a long-term care facility for a long time. I just wanted to have a change. I wanted to get expertise in all sectors. I'm just planning to work in hospital now. So it depends on where you have been working and how you want to work. You need to answer those questions. Other possibilities is people in position of authority, anyone who a principal, manager, any manager you have been working with. It doesn't mean that if you've worked right now, you're working. If any one of your manager, oh yeah, we worked with him, he worked with us as a security guy. Just an example. He's been very truthful. He was punctual. They would repeat, oh, okay. These skills, these traits this person has, it would add up in your resume. It would give you a chance to get better job opportunities. The basic tip about your references is ask your referee for the reference. Make sure the contact information is correct. Some of the times, if I am a person and I've been asked to do a reference, please make sure that you know how the person, does she or he answer calls, unknown calls. Would it be easy to go apply? Would it be easy for them to apply for you as a reference via phone call or email? Make sure you ask your reference about those preferences, how the person would be comfortable, and how you won't miss and get this reference done on time. Make sure the contact information is correct. Keep the reference informed. It shouldn't be like your reference, you put somebody's name on a reference list, the contact number, and then the person doesn't know somebody's gonna give you a call. Oh, he's applying? I don't know. He didn't tell me. They might not even ask any question from you. You always go for a follow-up, ask your references. If you get a phone call, you might get a phone call this afternoon. Have you received? Ask the employer also. I would like you to get my reference by on Tuesday or Wednesday afternoons. Person is available. So both sides you might follow up. Now, letter of application. A letter of application is also called as a cover letter. This cover letter gives you brief information about who you are, where you are from, what have you been doing, what is your interest, why you want to do it. It's a quick gist of things. It is also accompanied by a resume where you give the other information. The solicited letter of application responds to an advertised position, and it's always like the cover letter is made according to the job you are applying for. Unsolicited letter of application, it would inquire about potential job opening. It will be a general one. Organize the letter of application. Always tips that you would convey when it is when we're talking about professionalism. You have to be electronically, like your email background should be neutral. Never create a childish or you say offensive email ID. I never use cyber speak. Ensure that your resume is correct format. Do not have attachment that don't that open automatically or that do not open. So make sure there's nothing attached to your, if it's you have things, just see it should be in a way that where the client, where the employer wants to press them, then it will pop up. Do not put expired link or do not put something else there. Completing a job application form. Some employers, they expect you to complete the present job application form. Always write with reference to this job offer, PH4, whatever the blah, 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 2T2, all that number, and then you put it. So it will give, again, it builds up things. Oh, he is also applying for, he's also had there a reference number, a job. Where did you see this? Have you read it in a newspaper? Have you, those things get clarified easily. Some employers, they expect you to complete a present job application form. Attach your resume to your job application. Application may ask whether you're legally eligible to work in Canada or not. Your work-related skills, your employment history, the names, the numbers. If you have worked before with someone, they will tell you who you worked with, what's the name, do you have the contact number. They want to contact the person and ask why you're not, would you like to rehire this person, and why you're not working with this, what was the disconnect between your company and the person at that point. Reasons for leaving the previous job, why you left the previous job, and reference. Again, they will ask for that reference. Using social network sites. Important points to remember when posting information electronically is manage your identity. Make sure it's not put on in a way where it can be stolen. Control your privacy settings. Pay attention to the professionalism of your social media page or website. If you're posting something in LinkedIn, if you're posting something on Facebook, it is also a good way of social media network page on Indeed. So make sure what you're posting and how you're posting, and creating a private setting for yourself. Make sure all those things have been taken care of. Avoid those errors in spellings, grammars, and use of slang terms, and also some people are want to put those short names. Oh, you worked with Westminster College, WMS. Who has the time to check what is WMS? Those things, do not put those small abbreviated forms in your resume. Eh? It will not take you anywhere. The person will lose it. Really. Oh, okay. It's just a piece of resume that might take only an hour or so to create, and he's so late. That gives them an idea. He or she's so lazy to put those words there. How can this person work when they're so lazy about even putting information there? So do not use short words, shortcuts on anything. A job interview is employer's chance to get to know and evaluate you, to prepare, find out more about the position, about the agency, create a list of your values, about your skills, about your qualities, your interests, your goal, strength and weaknesses. Have examples of specific experiences that illustrate each, what your values are. You have decide what you should be highlighting in for your interview. Ensure that you have it on your portfolio. Prepare 3 references. Always put references on request, and then once they ask, you can give them those references. Because sometimes what happens is, if we have put the names already on our resume and we are using the same resume after, let's say, 1 year or 2 years, we might not be in good contact, or we might have lost the contact of the person. Then it will, if they automatically, based on the resume that we have provided, call that person, it can again cause a loss in the job. So it's always, you should put references based, would be on preference if required, or on preference. Once they ask you, okay, I'll give you the name and contact number, you can call them, or I'll give you the name and email number, you can always contact them, which we can change based on whoever we want the present time to be our reference. Group interviews, more than one applicant. Benefit, you may feel less nervous because you are not alone. Can be intimidating. It can be intimidating to think that your answers are being compared to other people. More than one interviewer, if you have more than one, they usually are very thorough, will ask you questions that test your ability to solve problems. Example, what do you do if things like this happen? What do you do if your patient is aggressive? What do you do if things happen? What do you do? So if you have more than one one person interviewing, there will be a chance to be asked all questions. If it's one, they run out of time. They just want to touch base the things that are really important and that are related to the job, present job, but not on the experience of what you have. If ever you have people who are you have more than one person there, they might ask you about your previous experiences. How did you do it? Then what did you do? What are your coping skills? They'll go over with things again and again. Then grooming, make a good impression. Hair should be neat, away from your face. Do not wear too much of makeup for women. Wear minimum jewelry, avoid large pieces, remove body piercing that are of religious origin, cover tattoos that may be offensive, because if too many tattoos, clients don't want to get care from people. They feel a little scared of those. They feel like they might be drug addicts and stuff like that. And when you go for an interview, if you have body tattoos, it would be much better if you wear long sleeves then and cover, or whatever amount of wherever it is, cover those. If it's on the leg, you can wear pants instead of wearing shorts, so that they will be covered for a while. Do not put perfume. Do not wear a perfume just because you're going for an interview. You're going to work in an area which is perfume-free area, smell-free. So it's better not to put all those things. When maybe it will say, then we'll go for that. Present clothing, present a business-like professional appearance with men. For men, wear a shirt, dress pants, socks, and shoes. For women, skirt or tailored pants. All clothing should be wrinkle-free. Ensure undergarments are fully covered and cannot be seen through the clothing. Avoid tight or revealing clothing. Shoes, they should be in good repair and well polished. Avoid running shoes, sandals, and shoes with high heels when you're going for an interview. That doesn't give a good impression. Arrive 5 to 10 minutes before you schedule time. Again, that creates a very big impression of being punctual. Always make sure to be before 15 minutes of your interview time. Even that is recommended for your work, that you will be there before 15 minutes. So try to put that thing from the beginning. Try to practice it from the very beginning. Do not bring anyone with you. Turn off your cell phones and do not use your phones while you're waiting for your interview, which is not, again, a good thing. Do not chew gum or smoke while waiting. Do not feel nervous. Take deep breaths. Calm yourself down. Just relax. For the interview. For the interview, greet the interviewer in a polite manner with a firm handshake. Stand until asked to sit. Do not just, when you go and you're standing, you just sit off your own. Keep standing until they say, have a seat, please. Thank you. When sitting, you use good posture. Some people drop off, go to the front. They're like this. No, be firm. Watch your body language. Make sure the way, because if you put your body in a sluggish way, it means your body language tells if you're already giving an impression of being tired from your body. No, be very vigilant, alert. That will give a sense of professionalism for a patient. Smile, use eye contact. If you don't use eye contact, you try to look down every time you're speaking to someone. It means it gives them a sense of being avoided. Anyone who, yes, some cultures we know we don't do eye contacts, but most of the time, if you're going for an interview, you should do eye contact. Otherwise, it would let them know that you're not interested here, or you might not be cope up with all these things. Speak clearly and with confidence. Do not be shy. Do not kind of lose it just because of anxiety. Try to be clear. Try to talk slowly. Think before you speak. Whatever piece of information you're giving, think one time. Take your time to answer questions. Do not use the interviewer's first name. Project on a confident image. Listen carefully. Take your time when you're answering questions. I mentioned it. Answer questions briefly and honestly. Speak positive about your previous job. Use experience to support your options. Oh, I've been, let's say, multitasking there. I have been multitasking in a sense. I've been teaching and doing practical. I was teaching and studying. I was working and studying. A lot of experiences that you can say. And if you are the one, ask the appropriate question, ask the right question. And if you have questions, make sure when you're asking, it is the question that should be asked at this moment. We are talking about confidentiality. You will talk about how much money will I get? Does it make sense? No. Thank the interviewer for his or her time. You can ask questions at the end of the interview. For now, I will keep on thinking about, I need to ask about this. I will need to ask her. Once the interview is done, then you can say, you can gently and politely ask, I have some questions just in case. Yes, please. Then you go and review your questions. Review the job description with the interviewer. The one who is interviewing you, always review. At this point, do not ask questions about pay rate, work hours, benefits, vacation time. Don't do that. It gives a very bad impression. It does not look like you are there for working. It looks like you are there for money purpose only. Because, follow up, send a brief thank you note after you have been interviewed. You can always send a note or just a box of chocolate or flowers, something, just to follow up and appreciate. Send the note as soon as possible, no later than a day after your interview. It should be sent within a day or by the morning. Otherwise, once you send it after 10 days, they don't remember you, they don't remember your interview, how it went, you might not even get that job. The note can be written handwritten or it can be done by computer. You mail the note, do not send any email because that's not good. Express your thanks for the interview and reinforce your interest in the position. Always make sure that once you are done with the interview, say thank you very much and reinforce them on your, you know what, as I mentioned, please, I want to make sure that I work in this facility just because I wanted to get experience for this. Make sure you reinforce one more time before you start. Employment's offer. Accept the job that is best for you. When you accept a job, also make sure that when you're accepting, look into, do you really want this? What things out of this match what you are looking for, what you want to. Agree on the starting date. She will tell you, you can start tomorrow. It's not possible. I'm working. Unfortunately, would it be possible if I start next week? Because I need to notify my previous employer. At the short notice, I won't be. Can I start next month? You can always ask a starting date politely. Do not be like, okay, I'll come tomorrow. What about your previous employee? You have nothing. You don't know how to deal with it. When it's done and you're offered, now you're accepting a job, that time you might ask on the acceptation, would you mind telling me how much you're going to pay me and what will be my hours of working? How many hours do I need to work in a day or per week or per month? Find out where to report on the first day. Where do I come with? You have two, and let's say 2 offices, or you have 2 floors. Where do I report? On Monday. Oh, okay. I would be here on time. So ask them, can you please give me the address of your, because sometimes you might go and get interviewed in the office and their long-term care facility or their residential home is somewhere else. Always make sure you ask them, can you give me the address where I need to reach down or come down on this particular day? Date, time, ask for employer's handbook and other agency information. Oh, do you have any handout for knowing how it works? It says, let's say, Dufferin, where Dufferin is, who are the beds, how many beds, how they care, who is covered, who is not covered. All things go under that. Clarify the job expectations and requirements and read everything before you start. During your orientation, you need to know each and everything aspect of this place. Oh, this is partially been helped by Fraser Health, funded by Fraser Health. You need to know about all those things. Who your employer, how much, and how it's going to be paying you off. Accepting an offer, you have a term of employment if it is a contract. What is the duration? What are the terms? If you are signing a contract with the client, with your employer, make sure, how long do I, if I'm going to work part-time with you, okay, 60 hours, 40 hours, and how often I need to change it. would it be a temporary line, a permanent line? That depends. If you're signing this contract, this part-time line, I want to sign it for 6 months. Okay. So there would be a time frame. Maybe the terms and conditions will be your probationary time that will keep you for a month or a week's time, and then if you do well, we'll continue with you. If not, then they would say like that. Conditional offer. Condition may be based on the health report. Oh, you would be able to start your new job once you are done with your TB test, and the result of the TB test and TB test should be a part of your portfolio, please. Probationary period, it's usually 3 to 6 months if you're working for if you have to start work and it's like a lion, you're working more than a year. So your probationary period would be between 3 months to 6 months. Benefits, are you eligible? Ensure to find out about benefits, especially if you're working directly or with the client. What are the benefits I would be able to, is it being then my dental coverage will be there? Is it if you work with Fraser Health, let's say, and you have even a part-time line, not a full-time, it's not mandatory to have a full-time line, but if you work 900 hours in a year, you will be covered for your glasses, you will be covered, your family would be covered for your glasses, you and your family would be covered for some procedures of dental, which is free, some physio. So all this you have to look into your benefits. You and your family would be covered under benefits. How to refuse or leave a job without leaving a negative impression. So what do? You don't want, once you spoke to them, they gave you a briefing about how it works and what happened, but you don't want to work anymore. You don't feel good about it. But it's not like you don't want to work forever with them. You might have to come back. So making things, or this employer can be a manager tomorrow in any other company, then he will not or she will not hire you. So not to leave a negative impression, how do we do it? This is difficult to do. You ask to meet your supervisor in person. You be honest, you be tactful and pleasant to your employment. You know what? Unfortunately, I was looking at it. I came for an orientation. It's too far from my place. Takes me 2 hours to come down. Takes me, let's say, I pay for my things. You just let them know what the truth is. When I'm working here, I have to pay for my kids just because I don't have a daycare. They might help me. It would be easy. I don't, my husband is working full time. Unfortunately, I'm unable to work right now. Would it be possible? It won't be possible for me to right now work with you. It's not leaving. Whenever I have a caregiver who can take care, I can always come. Okay, you're welcome to come back anytime, they might say. But even if they don't say that, you still don't leave a negative impression. You tell them the truth that my partner, whether husband, whether wife, an example, started a full time, we don't have someone to look after my kids. Simple, honest. I'm just giving you an example. You can, that's why you have to be very tactful, you have to be honest, you don't have to lie. Your employer should have a good impression of you. It's not just you told them I will be there and then later on you change your mind and you just disappear. No. Yeah, unfortunately, I was looking at this job posting. After going home, I realized whatever you think. Be as fair as possible if you're leaving a job because you don't want to, because you don't like that atmosphere. I worked here. I know, I'm so sorry, but I did get overwhelmed because of some employees, because of employees, because it's too much. I feel like we get disconnected at a point. It will let them know that there's a discomfort between each coworker the days I worked here. Oh, okay, we'll work on it, they might tell you. Always begin with what you like about the agency. Always make sure that good things first, then would be the bad. Then would be the reason. I know I love this place. But it's just far from my place. Unfortunately, I can't right now drive so far. Nobody is driving me home. It takes me 2 hours to be here and then 2 hours to go back home. Like, be honest. Tell them first the good things and then the thing that made you leave the job. Be specific when you're stating what you did not like. If you don't like something, just in short words, do not explain each and every bloody thing. If you are a valued employee, you must be asked to reconsider leaving. Either way, always maintain your professionalism. Do not let them override you, or do not lay yourself down. That's the thing for your job opportunities for today. Any questions for this one? Are we having any questions here for our employee and employers thing when we are creating it? Nima, are you there? Hello? I don't think so you are here, my dear. We don't get a reply from your side. I don't know why you don't reply while we are Amrit, is there any questions regarding this?
No, I'm okay with that. Are we done with today's class? I'm a bit
Yes,
busy, so I may not be
Yeah.
able to continue.
Yes,
further.
my dear. It's okay. No worries. Okay. Thank you very much. Take
Yeah.
care. See you.
Thank you.
Bye-bye.